Good evening, everyone. My name is Buffy Squires and I'm the Community Engagement Coordinator here at Musculoskeletal Australia. I'd like to warmly welcome you to our webinar tonight. I'm so glad that you were able to join us. Our MSK Kids program is constantly being updated and we've recently added a couple of new pages to our website, which you'll be able to see on your screen here. Please take the time to have a look at our new pages. One is on transition, and being National Pain Week, we've just added a new page which you can see there called Pain Resources. On our website page, you'll also be able to view our past webinars, check out our primary school resources, and find contact details for our MSK helpline nurses, where you can call and chat with a nurse about any concerns and also about up-to-date information regarding COVID-19, amongst many other things. If your child is aged between 13 and 20, you may also like to check out our new online chat group, Teen Talk. It's run through Discord, which if you have teenagers, they're likely on already. So it's a great place for teens to come together and chat with other young people who get it. You can find more information on our website, or if you have any queries, please don't hesitate to just shoot me an email at buffy@msk.org.au. I'd also like to encourage you to follow us on our Facebook page, MSK Kids Ost. This is where you'll be able to keep up to date on everything that we're doing here at Musculoskeletal Australia and MSK Kids. So our presenter for this evening is Tash Billich. Tash is a clinical dietitian and PhD student at the Royal Children's Hospital in Melbourne and also at Monash University. Her clinical role is in the weight management service and bone dysplasia clinic at Royal Children's Hospital. She has clinical and research interests in weight management for young people with special health needs such as physical disabilities. Without further ado, I'll hand the proceedings over to Tash. Thanks very much, Tash.
Great, thank you so much, Buffy, for that introduction, and thank you to Musculoskeletal Australia for having me tonight for this webinar. So as Buffy mentioned, my name's Tash Billich. I'm a dietitian and a PhD student from the Royal Children's and from Monash University. Here are my affiliations. So I cover a couple of different clinics at the Children's, as you can see on the screen. So just a bit of an overview of what I will be going through tonight. So I'll start with a background into nutrition in musculoskeletal conditions. I'll then talk a bit about weight management for young people, nutrition for bone health, anti-inflammatory diets, and then, as Buffy mentioned, happy to take any questions at the end. So why is good nutrition important for young people with musculoskeletal conditions? I'd just like to say that nutrition cannot cure juvenile idiopathic arthritis, or JIA, as I'll be referring to it as throughout my presentation, or other musculoskeletal conditions. However, good nutrition can support good bone health. It can support muscle health and strength, healthy weight and healthy growth. It can support mental well-being and prevention of conditions such as diabetes, heart disease, fatty liver disease, and these are called non-communicable diseases, so diseases that you can't catch, so they're not infectious, they're those kind of chronic long-term health conditions. So nutrition can also support prevention of nutritional deficiencies such as iron deficiency anemia, and one that's quite common for young people with musculoskeletal conditions is vitamin D as well, so I'll go through that a bit later. So there are a few specific issues that are specific to young people with musculoskeletal conditions and JIA. So they might be at higher risk of weight gain. They may have shorter stature. So this is especially true for those people taking long-term steroids, which can inhibit growth. They may be at risk of malnutrition or underweight, or also nutrient deficiencies. For some musculoskeletal conditions such as lupus, they might have a higher risk of heart disease. So there's some dietary strategies to support that as well. And particularly for those on steroids, they may experience an increased appetite, weight gain, and steroids can also weaken the bones as well. So there's indication for some nutrition strategies to support bone health for those on steroids. So I'll go through some specific strategies and assessment of weight management for young people. So while weight management covers both overweight and underweight, I'm specifically tonight going to focus on the overweight side of things. But you'll see throughout my presentation these kind of nutrition principles that I talk about are not just for young people who are above a healthy weight, but they can be applied to the whole family and for young people of any weight, whether it's above or within a healthy weight range. So just some definitions of terms so you understand what I'm talking about when I say these things. So as I mentioned, weight management can be the management of a higher or lower weight, but tonight I'll focus on a higher weight. Above a healthy weight, that refers to a body weight that is higher than appropriate for a young person's height. So these include terms such as overweight or obesity, and these are actually medical diagnoses. I prefer not to use these terms so much just in conversation or throughout my presentation because they are kind of the medical terms, and I prefer to use above a healthy weight, which is, as there's a bit of research around that, is less stigmatizing in terms of weight stigma. So that's my preferred term. Body mass index as well, just so you get an idea, it's what we would use to classify overweight or obesity. And this is the measure of a person's weight in comparison to their height. During childhood and adolescence, the BMI cutoff for, say, overweight or obesity changes as they get older and also varies between boys and girls. So that's why we use the growth charts, or healthcare professionals use the growth charts to look at trends in BMI as well as trends in weight and height. And just to see how that young person is tracking. So there are limitations to using BMI. They don't give you any insight into fat mass or muscle mass or other aspects of health, but looking at those trends over time can paint a bit of a picture about what's going on for that young person in terms of nutrition. So you may have seen the charts before at your local clinic or at your hospital, and typically these are the old paper versions, but you will typically now see these electronically. And just to give you an indication, this is what we would classify as overweight, and this is what we would classify as obesity. And so you can see the BMI changes as the young person gets older, so age is down the bottom there. So essentially, I'm wanting to kind of discuss what does weight matter. So for young people with JIA or other musculoskeletal conditions, they might be at risk of a higher weight. And it's really not about the number on the scales or what a young person looks like. It's not about physical appearances at all. It's really about the mental and physical health of that young person. And so particularly for young people with chronic healthcare needs, it's about that extra pressure that it puts on their body. And this figure you see down the bottom, so it's from quite a reputable medical journal. So it uses quite a lot of medical jargon, but you can see that being above a healthy weight can impact all parts of the body. So psychosocial being psych, being mental, and social being your social interactions with others. It can have a great impact on that in terms of depression. There's things like poor self-esteem. And so you can see all the other aspects of the body. One thing I just want to point out is down the bottom it says musculoskeletal. It doesn't mean you get a musculoskeletal condition from being above a healthy weight, but it can cause additional musculoskeletal problems, such as problems with the hips and knees and things like that. So if you have a child or a teenager, or someone who is above a healthy weight and you're concerned, I guess what is the first thing that you would do in terms of broaching the issue? Language is really key when bringing this up with a young person. We really want to avoid blame or shame. It's not the child's fault or the adolescent's fault, and it's definitely not the parent's fault. Words such as fat, obese, morbidly obese, chubby, those things can kind of have a negative connotation associated with them, so we want to avoid those types of words. And so the framing of how you bring up, weight management or weight with a young person is really framing it around physical and mental health and well-being, not in terms of their appearances. In saying that, it is important that the topic is brought up. So healthcare professionals have that role of bringing up weight, and they should be doing it in a sensitive way. I guess it is important for them to track weight and growth and BMI for young people to see how they're going. So just some suggestions in terms of how you might bring it up with a young person. So the doctor will measure your height and weight to see how you would grow, to see whether you are growing well. For some kids, their weight increases too much for how tall they are, and this can sometimes not be good for them. We will talk to the dietitian about the foods we can eat to make sure we're being as healthy as possible. So really just focusing on health and well-being, and growth is another thing, healthy growth, to you can focus on that as well. So the goals of management from a healthcare professional's perspective for a young person who is above a healthy weight, for pre and peri-pubertal children and adolescents, pre being before puberty starts, peri being during puberty, we would be aiming for weight maintenance, so weight stability. And so this would allow a young person to keep a stable weight, but their height will grow into their weight, essentially, and they will kind of stretch out, essentially. For post-pubertal adolescents, so those who have gone through puberty already, we can aim for some degree of weight loss, but this should be gradual, long-term, and we don't want to see any big drop-offs in weight, because this can be unhealthy, can cause extra issues, and yeah, we want that kind of long-term gradual weight loss. So in terms of how we achieve and maintain a healthy weight for young people, I kind of like to think of it as a house. So at the bottom, where the foundations are, which is very important, holds up the whole house, is family support. And I'll go into a bit more detail what family support might look like. But without family support, the whole house cannot stand up and we can't achieve what we want to achieve. So that's really, really important. There are then all these little blocks or bricks, that piece together to form really a healthy body and a healthy weight. We can't just do one and ignore the rest. We've kind of got to work at all of them. And for some people, this might be just kind of tweaking, nutrition. For some people, it might be ticking a few things, and it might be, a really long-term kind of change that they're aiming for. So we think about routines, mental health, nutrition, physical activity, reducing screens, and a good sleep. So I don't have time to go through all of these today as much as I'd love to, but I'll give you some suggestions at the end of where you can go for some help in terms of addressing some of the things that I don't have time to go through tonight. In terms of physical activity, just one thing to say is that, young people, especially with musculoskeletal conditions, may have different levels of tolerance in terms of physical activity. So it's really wherever they're at, and kind of working with healthcare professionals such as physios, to kind of, see where they're at and trying to increase it where they can, but being mindful that, we don't want to create extra pain or anything like that. Lastly, in our house scenario, we've got the healthcare professionals. So the healthcare professionals, such as dietitians, doctors, physios, they don't live in your house. They don't know, what goes on day to day, exactly. But what they can do is kind of look from the outside and see an overview of what's happening in your household, and make suggestions about what could be changed to support a young person's health and healthy weight. So they have that kind of outsider's perspective to kind of have a look at the situation and support you. Okay, so just a bit more on the family support, so the foundation of the house. So when it comes to managing weight, it really is a whole family approach. So there's actually a lot of evidence around this, that it's one of the most important things in terms of weight management programs or weight management interventions for young people. So the family means everyone in the household, plus any extended family or support networks that kind of have that regular contact with the young person. So it really needs to be everyone involved in helping out each other. Another few small tips would be creating a household that makes healthy choices the easiest choices. So having healthy snacks front and center of the fridge for after school. Avoid regularly having sometimes foods available in the house and keeping these for special occasions. So sometimes foods are also known as treat foods, discretionary foods, extra foods, things like chips, lollies, ice creams. So we don't want to cut these out altogether, but we want to keep them for special occasions. Making regular physical activity the norm in your household, even if it's just light activities as tolerated. So things like gardening, walking, just making those normal day-to-day family activities as the young person can tolerate. Implement structure, routine, and boundaries. So some examples might be family meals, and I'm going to talk a bit more about family meals later on. Bedtime routines, boundaries with and limits with screens, and kind of applying these boundaries to everyone in the house. So moving on to nutrition. And so it says nutrition and in brackets for a healthy weight, because as I said at the start, these are the strategies we would take for young people who are above a healthy weight, but really they can apply to anyone in the house and any other children, regardless of where they are in terms of the weight. So in terms of just a few kind of broad tips, avoid diets or fads or removing whole food groups. So there's a lot of misinformation on the internet about, cutting carbs, removing sugar, that kind of thing. We don't want to kind of remove whole food groups or, whole ranges of food. We really want to make it realistic and long-term. So as I've mentioned a few times, changes to food and drinks apply to the whole family. We want to plan for long-term, sustainable and realistic changes. So we don't want to make big drastic changes to food. We want to make little changes that are going to be able to be followed long-term. Embrace any traditional foods from your culture. So generally traditional diets are a lot healthier. And I'm going to talk a bit about the Mediterranean diet later on, but these types of diets are usually less processed and higher in things like fruits and vegetables and whole grains. So if you've got any great recipes that from your ethnic background, it'd be great to pass those on to your children and teach them about those foods. And as I sort of said before, no foods are bad. Sometimes foods can be enjoyed on special occasions, but recommended to not have sometimes foods every day. So some nutrition goals and some steps to some good nutrition for a healthy weight. Step one would be get organised. So know what's in your pantry. For example, you might be on the way home from work. You know that you've got canned kidney beans, some canned tomatoes, some spices and some rice. All you have to do is pick up some avocado and some corn on the way home and you've got yourself a chili non carne. So having those that bank of quick and easy meals for when you're really time poor or you're rushed or you've got lots of things to do can be useful. Planning meals ahead of time. Taking a shopping list to the supermarket, it sounds simple, but when you're going to the supermarket hungry, you kind of tend to get those more snacky type foods. And as I said, like if they're not in the house, then they're going to be easier to kind of reduce. Prepare for the unexpected. So some tips might be having healthy car snacks available if you're stuck in traffic or have an unexpected appointment that you have to attend. So things like nuts, popcorn, rice crackers, having quick and easy meals on hand. For example, frozen meals that you've either prepared yourself or it could be some healthier alternatives of pre-packaged frozen meals, frozen vegetables, pita pizzas, that type of thing. Knowing your healthy takeaway options in your area. So while we would prefer to always cook from foods at home. There are going to be moments where you are too tired, don't have the energy, too busy. So knowing what's available in your local area. Taking healthy snacks or a lunchbox to medical appointments. Sometimes you have no idea how long you're going to be waiting for. So it could be just a good idea just to have that food on hand. Also, sick day management plan for meals. So when a child's acutely unwell, it's not about managing weight or anything like that, but it's just about getting them through that illness. So, if they're going to be home and maybe less structure, at least having some healthy snacks and healthy meals that they can easily access will kind of get them through that illness. Step 2 would be eat regular meals. So when I say regular meals, it's all about timing, people, and place. So it's not just about, people generally think timing of regular meals, but it's also about the people and the place. So offer 3 meals a day, snacks in between if hungry. Many young people are hungry, so that's fine to have snacks. It's really normal to have snacks, but it's just about making them a good choice. Having regular family meal times are really important, and in a couple of slides time I'll go through a bit more detail about that. And sitting at the dinner table, or commonly today like an island bench is what people have at home, that's also fine, but trying to remove distractions, remove screens, turn TV off. For some families this might be a huge step. Some people might, some young kids might be reliant on screens to eat their meal, or say an iPad at the table. And this is okay. We want to move away from that. But, we don't want to completely overhaul dinner and change things that it causes distress and tantrums and people to get upset. So, this might be a very slow process. Depends where your family's at. I just want to touch on tips for managing appetite. I know appetite can be a big thing for young people taking steroids. So it is really, really tricky. And that's, it is really important to recognise that it is a really difficult thing to do, but there are some things that you can put in place. So consistent timing and mealtime routines. So the regular timing of meals allows young people to recognise their hunger and fullness cues and kind of learn those internal cues a little bit better. Avoiding grazing, because that makes it difficult to recognise these cues. If you're never at that point of feeling hungry, then you don't really know what hungry feels like, and you kind of don't know what fullness feels like. So having those regular meals at even kind of spacing throughout the day is important. Normalising hunger as well. So it is okay to feel a little bit hungry. We don't want a young person to be feeling starving, but that kind of little bit of hunger is good. It's your body telling you that you should eat something soon. Mindful eating, so no screens or distractions. And again, this might be a gradual process to get to this point, but it's really what it'd be good to aim for. So in terms of non-hungry eating or boredom eating or emotional eating, these are really common things. Sometimes they can be a bit more complex in terms of emotional eating, and might be something that you talk to a psychologist about if it's really causing problems. But some other things to try could be like distracting with activities that make your child or your teenager happy, that are unrelated to food. So, going to their favourite place on the weekend, or, having their favourite activities together in the afternoon after school, so they can just kind of go to their list of activities that they like and choose something from that rather than going to the cupboards. Veggies, and veggies. So veggies, except for potato, are really good fillers that aren't going to contribute to weight gain. So things like veggie sticks, salads, can pretty much eat those freely, and they're not going to contribute to weight. And another thing is even distribution of protein-containing foods across the day, so not just dinner. So typically in Australia and in a Western kind of diet, we eat all of our protein at dinner. It's recommended to kind of distribute this evenly throughout the day, so breakfast, lunch and dinner and snacks. Protein is the most filling out of the macronutrients, so out of protein, carbohydrates and fat. So having that even distribution across the day is going to help with appetite as well. And you can see some protein sources down the bottom. Cool. I just want to touch on family meals. So it's really important, and there's a lot of research actually out there about family meals. So a high frequency of family meals is associated with increased consumption of fruit, vegetables, and whole grains, so all the good things, better psychosocial well-being, reduced negative weight control behaviours or dieting, which can lead to kind of long-term problems. And more family meals is actually associated with a reduced risk of being above a healthy weight. And that's even 10 years later. So this one study looked at family meals, and kids who had more family meals in childhood, even later when they were adults, were in that healthy, more likely to be within that healthy weight range. So it's really interesting area of research. So step 3 is taking a healthy lunchbox to school every day. So I know there's a lot of kind of talk at schools about nude food lunchboxes, but they also do have nutritional implications as well. So generally foods that are not packaged are going to be better for you. They're going to be less processed, probably lower in energy and unhealthy fats, and the nude foods are probably going to be better, have higher nutrient levels as well. So just getting back to basics is really the key. So having a serve of fruit, a serve of vegetables, and a dairy snack, such as a yogurt, and then the main aspect of the lunch, so a sandwich, wrap, or salad. You might be thinking these lunchboxes would not fill up my teenage son. So if you do have someone who has a big appetite, just adding more of those types of foods rather than extra packaged foods would be the way to go. So just some other kind of tips there for what might constitute a healthy lunchbox. Step 4 is portion size. So in order to kind of achieve a healthy portion size, we're really thinking about filling up half the plate with vegetables. The 2 other quarters of the plate can be lean protein, such as meat, fish, chicken, or vegetarian alternatives, and then carbohydrates or starchy foods, so pasta, rice, potatoes. So I probably just want to focus on vegetables in this situation. We generally, as a nation in Australia, do not eat enough vegetables, but they're actually really important. And I think it's really important that we get to love vegetables and make them the star of the dish, make them taste good, get kids to eat more of them. They also have fantastic anti-inflammatory properties, which is a big focus of the Mediterranean diet, which I'm going to touch on at the end. So getting creative with making vegetables taste good is really important. So serving veggies family style might be a way to increase your family's intake of vegetables. Family style means having a plate of vegetables or a plate of whatever in the middle of the table, and then people can serve themselves, or say for younger children they might need help. It's particularly useful for fussy eaters who feel overwhelmed when they're served a big plate of something that they don't like. At least this way they can control how much they're going to try. And so we want to aim for half a plate or half a bowl or whatever it might be of vegetables or salad. But this might be, again, a long-term thing that you kind of aim for. It might not happen straight away. Another kind of good thing to do would be getting young people involved in cooking, meal planning, and gardening. You know, meal planning doesn't require any kind of physical you know, ability. So, you know, that can be someone for a young person who experiences a lot of pain. You know, gardening might not be possible, but meal planning is definitely something they can get involved on, and they can have a bit of control about what's going to be served for dinner. And step 5 is avoiding sugary drinks. So these would be a sometimes drink or food, and it's recommended to remove these from the household. Just keep them to special occasions only. So you can see sugary drinks there, probably something that you're all aware of. But if you want some more information about sugary drinks and how much sugar is actually in our common drinks, there's a good website there that has some good resources. Okay, so moving on from weight management to nutrition in for bone health. So there's a couple of different things that are really important in terms of bone health. The first being calcium. So it's really important for bone and teeth strength. The key sources include dairy foods, foods and drinks with added calcium such as soy milk, some fruits and vegetables. But just need to point out that, you know, we've got down the bottom, we've got a glass of milk. It's got the same amount of calcium as 2 kind of thin slices of cheese. But to get the same amount of calcium from your plant sources, you'd need 150 grams of boiled spinach, 100 grams of almonds, or 4 to 5 cups of broccoli. So I don't know many young people that are going to eat 5 cups of broccoli, but it's tricky to get enough calcium from those plant sources. Fantastic to include them, but pretty much need to be considering dairy foods or those alternatives such as soy milk that have the calcium added into them. So young people need quite a bit of calcium, and it's recommended that they have, you know, up to 3.5 serves of dairy foods depending on their age. So you can see their age slightly different for girls and boys in terms of dairy foods required each day. So a serve of dairy food might be a cup of milk, a couple of thin slices of cheese, a tub of yogurt, so an individual tub of yogurt, things like cottage cheese and ricotta. And you might be able to see it might be a little bit small, but also small fish with bones in them, such as sardines. Don't know many young people that would eat that, but you know, the bones in the little fish contain calcium, so there is a source there. Other things like tofu as well, but just check the label. They have varying levels of calcium in them. So vitamin D. So vitamin D is calcium's helper. And it's important for the immune system as well. So there's a bit of research that suggests that young people with JIA have lower levels of vitamin D, but it is really important for them. So it's important that young people with musculoskeletal conditions get their levels checked. It's really important for young people taking steroids as well. So there's not a lot of food sources of vitamin D. You can see a couple of them added on the screen there. The main source of vitamin D we get naturally is from sunlight. So it's really a conversation to have if you're thinking about increasing, you know, exposure to the sun. It needs to be done safely first and foremost, and talk to your doctor if you have any concerns about how much or is enough. For young people with lupus, they may be more sensitive to the sun, so it's important that you speak with your doctor if you've got any concerns. And it's a biological fact that those with darker skin tones may need more sunlight to get enough vitamin D. So those with darker skin tones, they may require supplements, or they may be more likely to be low in vitamin D. But you know, supplements are very commonly available and commonly taken, so good to get your levels checked, or your child's levels checked, and speak with your doctor or your dietitian about starting some supplements if their levels are low. Okay, so lastly, would like to go through anti-inflammatory diets. So, you know, of course, musculoskeletal conditions are inflammatory conditions. And there's a potential role of anti-inflammatory diets for these conditions. However, there is not a lot of research out there, particularly for young people. So, you know, while we can't say that anti-inflammatory diets improve outcomes for young people with musculoskeletal conditions, there is some evidence to support anti-inflammatory diets in other aspects. So the one that has the most scientific evidence behind it is, and that's for children and adults as well, is the Mediterranean diet. So it's shown to have beneficial effects on preventing non-communicable diseases, so those diseases that you can't catch, such as diabetes and heart disease. It's a safe, long-term style of eating. And it's also associated with a lower risk of being above a healthy weight in young people as well. So what does the Mediterranean diet look like? So this is quite an old image that's the typical Mediterranean diet, but it's still quite applicable to today's time. So down the bottom, so the bottom row of the pyramid, they really emphasize family time or family meals, regular physical activity, and those social interactions. So it's kind of interesting that it's a food pyramid, but those things are perceived to be really important, and that family way of eating is typical in the Mediterranean diet. The next row up, you'll see fruits, vegetables, whole grains such as whole grain bread, starchy vegetables such as potato, and olive oil as well. And probably a bit harder to kind of see, but there's probably herbs and spices in there as well. So these are the real key elements of the Mediterranean diet in terms of their anti-inflammatory properties. So we know that high consumption of fruits and vegetables can be anti-inflammatory. Whole grains as well, fiber-rich foods can be have anti-inflammatory effects. And the other key thing is olive oil. So the Mediterranean diet really focuses on olive oil and is quite liberal in terms of how much they recommend. That's kind of the main healthy fat that you would use, plus things like avocado as well. And things like herbs and spices, there's antioxidants that have those anti-inflammatory properties as well. The next block up would be seafood and fish. So they suggest having those 2 or 3 times a week for the Mediterranean diet, and those oily fishes such as salmon, such as mackerel, contain anti-inflammatory properties through their omega-3 fatty acids. So these are kind of a key protein source for, within the Mediterranean diet, and they're consumed less than things like chicken or red meat, which are kind of at the 2 blocks up there. So you can see dairy as well in the next block up. I don't really want to focus too much on the quantity of these foods per week or per day, because it really varies on a child's growth, development, age, boy or girl, that kind of thing. So I wouldn't get too hung up in the amounts, but just to give you a general idea of what a Mediterranean diet looks like. So there's some particular research in children for the Mediterranean diet, and this just gives you an idea of what some good things and some probably not so good things are in terms of achieving a Mediterranean diet. So this is the KidMed questionnaire, and so a +1 is good, that's pro Mediterranean diet, and -1 is not so good, that's not in line with a Mediterranean diet. So things like takes a fruit every day, has fresh or cooked vegetables more than once a day, they're all +1s. Some -1s would be skipping breakfast, so kind of tying into that regular meal pattern, and sweets or candy, obviously American, of several times a day would be a -1. While it's a little bit of a different way of looking at things, it's really, the Mediterranean diet is really not much different to what we would recommend in Australia, but unfortunately not a lot of people in Australia follow kind of this general healthy eating pattern. It is kind of more of that processed foods that we generally consume. So I think whatever helps in terms of framing, but I think the Mediterranean diet is a good way to go. Some specific considerations for young people if you're thinking about a Mediterranean diet. While they have the dairy foods right at the top of the pyramid, young people do need enough calcium for their bones, or dairy or calcium containing alternatives. So just need to make sure you're having enough of those. Iron's also really important, especially in younger children. So they do need to consume either red meat or other iron-rich sources. They shouldn't kind of ignore the iron containing foods, and things like, so if you're adding olive oil liberally or in quite in more, bigger amounts, then you just need to be careful of overall portions of the other foods, because it can make them the food more filling, or might make it more have more kilojoules essentially. And the other thing to remember is that, every food's okay in moderation and for special occasions. So we don't want to be cutting out things. We don't want to be, aiming for a perfect Mediterranean diet. We still need to enjoy our favourite foods on occasion. It all can be a little bit confusing. So if you have any doubt about what you should do for your family, see a dietitian. The Mediterranean diets, vary. There's a lot of nutrition research out there on that, so they'll be able to advise you on the best way forward. So it's nearly coming to the end of my presentation, so I just wanted to touch on where you can actually go to get some help, because I mentioned a few things at the start about how to manage weight and who needs to be involved, potentially for each of the bricks in the house. So if you think mental health is a problem for your child or your teenager, there's places that they can go for help. So I've listed some key people and organisations on the screen. As I mentioned, if you're confused by anti-inflammatory diets and or just general healthy eating, a dietitian would be the best person to go to. So look for someone with paediatric experience. A GP is a good starting point, or your paediatrician. You've also got your local community health centres, which most would have a dietitian. And you can also go to Dietitians Australia website and look for a dietitian through there. Other people would be really important is a physiotherapist. So, physical activity, really important piece of the puzzle, but that can be tricky for young people experiencing pain or chronic health conditions. So see a physio if you don't know what to do or need some extra advice, or your child needs some extra guidance. They'll be able to help. So again, look for someone with paediatric experience. Another thing which I didn't really talk about too much, but fussy eating or sensory issues, so not liking textures or certain tastes or certain smells, there's a list of people that can help there. So if in doubt, you can look up one of those to see in your local area. If you're wanting some more resources on managing weight, the RCH website, click on weight management and there's some resources there. There will be a specialist weight management clinic in most states, depending where you're tuning in from. So see your GP or your doctor. There's generally more options on the eastern side of Australia, but do see your GP or your doctor if you'd like a referral to a weight management service, and they can guide you through that. There are particular referral criteria depending on the clinic. So yeah, that's it. GP is probably a good starting point. Great, thank you so much. Thanks so much for listening, and thanks for having me tonight on this webinar. I'm happy to take any questions.
Thank you so much, Tash. That was a fantastic presentation and so much information for people to take in there. So rest assured, everyone, you will get a recording of this so you can go through it again at your own time when suits you. But we've got quite a few questions coming in, which is great. So we'll get on to those. The first one I've got here is low fat versus full fat for dairy foods. Does it matter? Does it depend on what age the child is? What would be your recommendations around that?
Yeah, so bulks, and if you're transitioning from breast milk or formula milk to cow's milk, that would be full cream. But if we're talking about older children, adolescents, generally low fat is fine. For young people who are struggling to put on weight, we might recommend a higher fat dairy source to increase calories. But for general healthy eating, I'd go with the low fat. Does it make a difference? It depends how much you're having. If someone's having a tiny bit of milk in their cereal and that's all they're having, and they prefer the taste of full cream milk, then that's fine. Doesn't really matter. It's not going to make too much difference. But I know a lot of adolescents are drinking litres and litres of milk a week, so that kind of does add up in terms of the difference in the fat. So for that kind of situation, I'd go for the low fat.
Excellent. Yeah, makes sense. Another question saying eggs. I know there was a lot of talk about eggs being bad for your cholesterol. Is this still true? Can our young people be eating eggs?
Yeah, so that's a really good question. As a starting point, I'd recommend going to the Heart Foundation website. They have some really good resources about eggs, but that is an outdated thing that eggs increase cholesterol. So eggs are a really nutritious, safe part of healthy eating. I mean, there's no specific guidance on the amount of eggs, but really it's not like it used to be with saying limit eggs to limit the cholesterol. They're a really healthy part. Eggs contain all the vitamins and minerals except for, I think it's vitamin C. So they're really kind of a bit of a powerhouse food. So they're a really good part of the diet.
Okay, it's good to know. I like eggs. This question says, we've covered a lot about how to manage children with a high BMI, but what about those with a low BMI? What foods should they be eating to gain weight?
Yeah, so I mean, it really depends. I'd recommend going to have a chat to someone about it, so a dietitian or say Starting Point GP or maybe a pediatrician if you're linked in with one. So I guess the overall concept of managing underweight would be things like increasing total kilojoules and increasing protein as well, and things like kind of even distribution of protein across the day would be another important thing. And that's kind of me answering that without going too specifically, because it really does depend where the age of the child, what the reasons why they're not gaining as much weight as maybe they should be. So yeah, it's best to go and have a chat to someone about it.
Yeah, and certainly for some of our kids with JIA, some of the medications they're on will make them feel nauseous and so on, so that can contribute to not wanting to eat.
Yeah, exactly.
Sorry. What are your thoughts on turmeric supplements for a child's diet?
So, I mean, I haven't looked into the research on turmeric supplements. I know that there are some anti-inflammatory properties of turmeric. With the anti-inflammatory side of things, there is a bit of evidence going into more of that whole diet approach. So rather than those kind of single things that you add in, it's really about your whole way of eating. So that's why the Mediterranean diet kind of covers it, including those spices such as turmeric and herbs and vegetables and all that kind of stuff, and looking at that holistic way of eating. To be honest, I'm not sure about the specific evidence for turmeric supplements. So yeah, probably something that you'd want to check with your doctor as well, just if they're taking medications. Sometimes supplements and medications can interact, so it's probably a good thing to check out.
Yeah, absolutely. Okay. Got another question here saying, my teenage daughter wants to be vegetarian. How do I ensure that she's getting enough iron?
Yeah, so iron from vegetarian sources is not as easily absorbed as meat sources or things like animal sources, pretty much, so eggs and meat. So it is important to kind of focus on iron for vegetarian eaters. The other thing would be to things containing vitamin C, so fruits and vegetables pretty much help iron be absorbed. So you want to kind of pair those things together. So it is quite tricky. So again, probably plugging the dietitian's website, but I think it's good to go and chat to someone because it's quite tricky, especially for young girls who need a lot of iron to get enough. But things like legumes, so lentils, beans, whole grains. There's also, some cereals that have iron added into them, and some breads and things have iron added into them. So all of those types of things are vegetarian sources.
Yeah, fantastic. Another question here. Thanks for the presentation. Any thoughts on foods to avoid that may increase an inflammatory response in kids? So might that be things like too much sugar?
Yeah, and so it can be things like too much sugar. it's more of a long-term inflammatory process. So, there's no evidence to suggest like having a high sugar meal will cause an acute flare-up, but it's about that long-term chronic inflammation, which is present in some conditions like diabetes and heart disease. It's that kind of long-term inflammation that a high sugar diet or a high processed food diet can kind of cause. So I think probably don't want to remove, all food groups, say all sugar foods, but that kind of general healthy eating, like eating less processed foods, less salt, less sugar, by kind of consuming more fruits and vegetables and whole grains, can kind of reduce the overall sugar intake and is more of a anti-inflammatory way of eating. But as far as I'm aware, there's no foods that particularly trigger a flare.
Yeah, okay. One family have asked, they love to have a takeaway on the weekend. What would be their best takeaway options?
Yeah, so I guess it depends what's in your area, but I think I put one example on the slide that like charcoal chicken is, you could have that with a salad and some rice, and that's a healthy option. If you kind of generally looking at the menu, like anything that has a lot of vegetables, so things like Asian cuisines where you might get stir-fried vegetables in the dish, that will be more of a healthier option rather than those meat-based dishes or foods containing not a lot of vegetables like pizza, or having say if your family did want to have a pizza, having getting some salad on the side, and everyone has a little bit of salad and a little bit of pizza, and kind of just balancing it that way.
Yeah. Now I hope you're going to say that sushi is okay, because that's my favorite.
Yes. Yes, sushi is great. Yeah. Yeah.
Excellent. Good. Next question is, hi Tash, what are your thoughts on removing inflammatory foods from kids' diets, in particular normally healthy foods like gluten, nightshades, dairy, red meat, etc.? Any evidence behind removing those?
Not that I'm aware of, no. So there's a small study in gluten and potentially removing lactose. There's small studies, they've been conducted in adults. Don't think there's anything evidence for children, and don't think there's enough evidence at all to support removing those things. So I would avoid kind of removing things unless it's indicated for some other reason, for example, celiac disease and gluten, or food intolerances can be a real thing. So just chatting with your doctor or your GP if you suspect that kind of thing. But there's really not enough evidence to back up removing things out of kids' diets.
Yeah. Okay. Another family here who obviously are struggling to maintain weight. So other than full cream milk, what good other foods would you recommend to increase a child's weight?
Yeah, so protein rich sources will be important. So, things like dairy, meat, eggs, and you can do things like add extra oils and cream, that kind of thing, to cooking if you're trying to increase the weight. But again, it's really specific on each child. And so I wouldn't recommend going to add cream to everything because you need to address that underlying underlying cause of the undernutrition. As you said, Buffy, like it might be nausea or gastrointestinal symptoms because of medications, and so you kind of want to address that and help manage that before you can address the broader the reason for the undernutrition.
Yeah, absolutely. A question here, my son would like to move to oat milk rather than dairy milk. He's not dairy intolerant, he just prefers the taste. Is there anything I need to consider with this? Yeah,
so the calcium, definitely. There are not a lot of oat milks available with calcium added. So just be really careful when selecting those in the supermarket. And so that would be the main thing, is just the calcium. You want it to match what would be found in dairy milk. It depends on that young person, but it depends where they are in terms of they might be really active or you've got to consider the protein's not going to be as high as cow's milk in protein. So just consider that as well. But yeah, so calcium and protein are probably the main things for that.
Okay, excellent. Thank you. Another one here saying, my teenage son likes to drink a sports drink when he plays soccer on the weekend. Basically, how bad is it? And should he, if he wants a soft drink, taking one with diet sugar, a diet soft drink? Is that better than a normal soft drink?
It's a tricky one. So I think unless the young person's doing a lot of activity, they probably don't need a sports drink. Sports drinks are okay for athletes, but they're generally not required for people who just have, can't think of the word, but just, that usual level of activity. So it'd probably be good to encourage him away from any kind of sugary drinks unless it's kind of, a special occasion or, birthday party or whatever, that's fine. But on a weekly basis, probably if he's playing sport, water is the best thing to have. And in terms of your question about the diet versus sugar containing, it's a tricky one. Both I would say an occasional thing. I think just because something's got diet or, something's got like a diet soft drink doesn't mean you can have it all the time. It's more of a sometimes food. We don't know the long-term impact really of those kind of added sugars or fake sugars. So I think a safe bet would just be having them on occasion rather than all the time.
Yeah, makes sense. Okay, so that is pretty much the end of our questions, and we are bang on 8 o'clock. So I would like to say a huge thank you, Tash, from all of us here. I've had lots of thank yous also come through in the questions saying great presentation, so well done. And thank you again to Tash for a great presentation tonight.
Thanks so much for having me, and thanks for listening in, everyone. Thank you.